CMC Practice Test 2026 Certified Medical Coder Exam Questions and Certification Prep. Question 1. Which coding system is used to report professional services and procedures performed by physicians? ICD-10-CM, CPT, HCPCS Level II, ICD-10-PCS. CPT, current procedural terminology, is used for physician services. Question 2. In ICD-10-CM, what does the X placeholder serve as? Indicates a deleted code, allows for future expansion and keeps the 6th or 7th character in place, represents an unknown diagnosis, signals a surgical complication. The placeholder X is used to allow for future expansion and to maintain the correct character position. Question 3. Which modifier is used to indicate that a procedure was discontinued after the administration of anesthesia? Modifier 52, Modifier 53, Modifier 25, Modifier 59. Modifier 53 is used for discontinued procedures due to risk to the patient's health. Question 4. Which of the following describes upcoding? Using a code that represents a higher level of service than was actually provided. Using multiple codes for a procedure that has a single comprehensive code. Billing for services not rendered. Changing the diagnosis to match the procedure. Upcoding is a fraudulent practice of billing for a more expensive service than the one performed. Question 5. The global surgical package typically includes preoperative, intraoperative, and postoperative care, only the surgery itself, only the postoperative follow-up, the initial consultation and the surgery. The global package includes all routine care related to the surgery within a specific timeframe. Question 6. Which part of Medicare covers physician services and outpatient care? Part A, Part B, Part C, Part D. Medicare Part B covers medically necessary services, physician visits, and preventive services. Question 7. What does E/M stand for in medical coding? Emergency and monitoring, evaluation and management, examination and medication, electronic medical record. E/M coding is used to determine the level of service provided during patient encounters. Question 8. An established patient is one who has received professional services from the physician or another physician of the same specialty in the same group within the last 1 year, 2 years, 3 years, 5 years. A patient is established if they have been seen within the past 3 years. Question 9. HCPCS Level II codes are primarily used for inpatient hospital procedures, durable medical equipment, DME, and supplies, laboratory tests, anesthesia services. HCPCS Level II national codes cover supplies, drugs, and DME not included in CPT. Question 10. In ICD-10-CM, codes in Chapter 20, V00Y99, are used for diseases of the blood, mental disorders, external causes of morbidity, congenital malformations. Chapter 20 covers external causes such as accidents, injuries, and environmental factors. Question 11. Which organization maintains the CPT code set? CMS, AMA, WHO, NCHS. The American Medical Association, AMA, owns and maintains CPT. Question 12. A sequela is defined as the primary reason for the visit, a condition that is the late effect of a previous injury or illness, a surgical complication, a symptom that resolves quickly. Sequela refers to a residual condition that remains after the acute phase of an illness or injury has ended. Question 13. What is unbundling? Coding each component of a procedure separately when a single code exists, combining two different diagnoses into one code. providing a discount for multiple services, sending a single claim for multiple patients. Unbundling is an illegal practice of separating components of a procedure to increase reimbursement. Question 14. Which of these is a Z code used for? Reporting a major surgery. Factors influencing health status and contact with health services. Example: annual checkup. Infectious diseases. Neoplasms. Z codes are used for encounters where the patient is not currently ill, such as for screenings or history. Question 15. The National Correct Coding Initiative (NCCI) edits are used to determine physician salaries, prevent improper payment when incorrect code combinations are reported, translate CPT to ICD-10, register new medical devices. NCCI edits promote national correct coding methodologies and control improper coding. Question 16. What is the purpose of the ICD-10 official guidelines for coding and reporting? To set the prices for each code, to provide rules and instructions for accurate code selection, to list all available medical supplies, to provide medical advice to patients. The guidelines provide the standard rules for selecting and sequencing diagnoses. Question 17. In E/M coding, the three key components, prior to 2021/2023 updates, were history, exam, medical decision-making, time, counseling, coordination of care, anesthesia, surgery, radiology, diagnosis, treatment, prognosis. Traditionally, history, exam, and MDM were the three pillars of E/M level selection. Question 18. Medical necessity is defined as whatever the patient requests, services that are reasonable and necessary for the diagnosis or treatment of illness or injury, the cheapest available treatment, services provided in an emergency room only. Payers only reimburse services deemed medically necessary according to accepted standards. Question 19. Which modifier indicates a significant, separately identifiable E/M service by the same physician on the same day as a procedure? Modifier 24, Modifier 25, Modifier 57, Modifier 59. Modifier 25 is used to report an E/M service that is distinct from a procedure performed on the same day. Question 20. Which of the following is a Category 2 CPT code used for new and emerging technology, performance measurement and quality tracking, durable medical equipment, anesthesia services? Category 2 codes are alphanumeric tracking codes used for quality payment programs.